Oh, what a delight to have with us today Chris Conover in his book, American Health Economy Illustrated. Really, this is a great resource, and you may want to check it out, put out by AEI, which is American Enterprise Institute. And Google that, check it out, Barnes & Noble, online at Amazon, and at local bookstores. Chris, what a delight to have you with us, sir.
Thank you. Thanks for having me.
Boy, this is really a detailed book. You did a lot of work in a fast amount of time to get this done.
Right. Well, I've been teaching health policy at Duke for more than a decade. And this book is really a synthesis of material that I've used in teaching for a long, long time. But I wanted to explode a lot of the myths that were going around about healthcare in the United States, because I think some of those myths led us in the wrong direction in terms of a solution for how to resolve some of the problems with our healthcare system.
All right. Let me ask you this. Do you think, healthcare being what it is and the Obamacare being what it is, we're all waiting with anticipation as to what the Supreme Court's going to say here in the next week or so. Do you think the average American understands this whole subject?
No. Newt Gingrich once said that health policy is about 30 times as complicated as national security policy. And I don't know how he arrived at that particular ratio, but I think he's right, that it's very, very complicated. And I think it's hard for people to understand all the ins and outs of this issue. They wish there were just a simple solution and we could get on with things.
Let me ask you this. Do you think, how would you rate America's health care today? Now, not what's being proposed through Obamacare, but how would you rate America's health care today in relationship to other health care systems in other countries?
Well, it's a lot better than people think. Too many of the international comparisons are flawed because they're using the wrong data, or they're analyzing things incorrectly, or they're comparing apples to oranges. So just as one example, the Congressional Research Service looked at the United States compared to other countries in terms of health expenditures. And it turns out when you look across countries, per capita income explains about 90% of differences across country in their per capita health spending. But it said that even taking into account the fact that the U.S. has a higher GDP per capita than most other countries, we were spending 60% more than we should, according to the model that the Congressional Research Service put together. I looked at those same data, and what we did is we took the United States, which there's a lot of variation even in the United States. There's a 2-to-1 difference across states in per capita healthcare spending. If you compare the highest per capita state, which is Massachusetts, to the lowest. And there's a 5-to-1 difference in per capita income. So when you take one country like that and in the Congressional Research Service analysis, they represent the U.S. as one data point on this graph. Wow. And that's just very, very misleading. When you do things right, I conclude that the United States actually spends about what it should on health care. And single-payer countries such as Canada and Britain end up spending 20% below what they should, which suggests a level of rationing that I don't think most Americans would be comfortable with. And France, which allegedly has the best healthcare system, according to the World Health Organization, spends 20% too much relative to its incomes. So compared to those other countries, it turns out we actually are doing pretty well, but that's not what the conventional wisdom says.
All right. A couple of questions that come out of that. Is somewhat of a short answer. What country has the worst system out there, as far as a modern country, maybe a first or second world?
Well, it depends who's doing the counting. I mean, we allegedly, according to the World Health Organization, rank 37th in the world. That's pretty silly to think that,
Okay.
I guess I don't believe that. Yeah. And people, Arab sheikhs who fly here to get the best medical care in the world obviously don't believe that. They could go to anywhere in the world, but they end up in the United States. They don't go to France. They don't go to Canada. They don't go to Cuba, which allegedly is ranked very close to the United States, according to the World Health Organization. So, and the World Health Organization ranks all the countries. So, the bottom country is ranked, like 180th. And it's going to be a very, very underdeveloped country. I don't remember which country that is.
All right, so let's take a look at Obamacare. How would you rate it? What would it do to us in our current standing?
Well, I don't think it would do much to improve our standing, unfortunately. First of all, it's not actually going to bend the cost curve down, even though it was advertised as doing that. It's not going to reduce the deficit. It's not even going to cover all of the uninsured. There's still going to be 25 million uninsured after we're done, and we'll have spent $1 trillion and still not gotten universal coverage out of it. So I think it falls far short of what it could be, especially given the amount of money that we're investing in this massive reform.
Should government play any role in health care?
Well, I think government does have a role to play in healthcare, but I think it's much more limited than a lot of people think. A lot of people, again, this is going back to simplicity. A lot of people think, well, why can't we just have Medicare for all? That would be really simple. Just raise the taxes you need, and then everyone gets medical care whenever they need it. There's a couple of problems with that. One is that it costs a lot of money to raise $1 of taxes. That is, for every dollar of taxes you raise, it actually costs the economy about $1.44. You get $1 of revenue, but you also lose about 44 cents worth of output because either people are working less or they're buying less. Whatever you have taxed, you're going to get less of. We know that. We have empirical evidence that proves that. And for that reason, I think we ought to be using government dollars very, very judiciously and only use those to subsidize care for those with low incomes who can't afford it. To me, if it's costing the U.S. $1.44 for every tax dollar we raise, it's crazy to be spending tax dollars to pay for Medicare for, Warren Buffett, for example. Mm-hmm. That just doesn't make any sense to me at all. That's a very wasteful way to do things. So as I say, there is a role for government, but it's much more limited than the role that's envisioned in Obamacare. The other concern I have with Obamacare is not only are we using taxes to finance a lot of this care, but we're also centralizing the control of a lot of decision making. We're not trusting markets to do nearly as much as markets actually have been demonstrated to be able to do in terms of holding down costs and improving quality.
Are these current healthcare expenditures, Chris, or some of the spending trends, are they sustainable?
Well, no, I'm very concerned, and partly because tax expenditures are driving this to a great extent. According to the Congressional Budget Office, within a few decades, we're going to be spending half the economy on health care if we remain on the current track. And as I say, Obamacare really doesn't take us off that track unless we get into very, very severe levels of rationing. And the biggest driver or the biggest problem in the current system, I would say, that is the number one problem we need to fix is the Medicare system.
Yeah, I was just going to go there.
Which we've had for 50 years. We've had lots of opportunity to fix it, but we seem to think that the solution is throwing more dollars into the pot to pay for that care. And instead, I think we ought to be using more market-oriented mechanisms to get people to care a lot more about the prices that they pay for things and what they're spending their money on.
Is Medicare fixable to the point where we can salvage it and save it?
Well, yes. Representative Ryan has come up with a plan for fixing Medicare that I think has a great deal of promise. And it would save, many trillions of dollars over the years if we were to adopt it. And basically the idea is we need to move away from a defined benefit. That is, right now we say to people on Medicare, we're going to, help subsidize whatever physician services or hospital services or medications you pay for. The government's going to come in, or your Medicare plan is going to come in and subsidize a certain percentage of that. So it's a guaranteed level of benefits. A more promising approach is to say to Medicare folks, here's the fixed amount of dollars. The amount of dollars you get is going to depend on your income. So we're going to give more dollars to lower income older folks who can't afford their premiums. And we're going to give a larger amount of dollars to people who have chronic illnesses, who have greater medical needs. And people are going to use those dollars to shop for private health insurance plans in private markets. And when they have a fixed amount of dollars, instead of being offered sort of an open-ended subsidy, no matter what plan they pick, they're going to be very careful to choose a plan that provides good value for the money for them. And they're going to steer away from plans that cost more, because any plan that costs more than the dollars that they were given to pay for their coverage, 100% of the additional costs are going to be paid for by that senior citizen. So they're going to think very hard about which plan to get into. And what you would see under this kind of an arrangement is plans that will specialize in caring for people with particular chronic illnesses, such as diabetes or MS or whatever condition you might have that possibly costs tens of thousands of dollars to take care of every year. You'll find plans that specialize in treating that illness, that get state-of-the-art technology to deal with it, that get the best medications to make sure that you retain your functional status, et cetera. Wow. And there'll be a real competition. You won't be at a disadvantage just because you have a chronic condition and you cost a lot. It doesn't mean the insurance companies are going to steer clear of you, because you would be getting an extra bolus of dollars that would go towards think of it as a voucher. Your voucher would be that much more valuable, and all the plans would be competing for your business, knowing that maybe you spend $20,000 a year on your medical care. Let's say they're trying to get a 5% profit. They're going to earn a bigger profit on a $20,000 per year person than they would on someone whose care only costs $5,000 a year. So at a certain level, the most expensive patients under this model actually would end up being competed for the most fiercely in the market. And this model, it sounds totally hypothetical, but it's not. We've actually used this model in Medicare Part D. Right now, Medicare Part D provides a whole literally hundreds, or actually more than 1,000 different Part D plans are out there providing prescription drug coverage for seniors. Seniors have been shown to be able to navigate this marketplace and make pretty sensible choices. They don't make perfect choices, but I don't make perfect choices either when I'm, shopping for a car or a computer or making other complex choices. But the market works well enough that what we found out in Part D is that the costs of that program are 40% below what the CBO projected they would be when the program began in 2003.
Wow.
So that's a demonstration, it's real world experience with markets, with a market-oriented system where you trust consumers to make sensible choices, and you allow the private sector to compete for patients. And when you structure markets well, they can work, even in medical care.
Well, Chris, this is fascinating, and it's a very comprehensive book, American Health Economy, illustrated by Christopher Conover. He's a scholar there at Duke University. And Chris, thank you. I can tell that this is an incredible topic, and yes, we don't give it enough time or enough thought, quite frankly, but your last answer to me was the most important part for us to consider, because there are some solutions out there. You point that out very, very well, and hopefully we become educated in this process. In the meantime, I guess we just wait and see what the Supreme Court does before we have to tackle what's next. Is that correct?
Well, right. What we know is that the Supreme Court is going to resolve the constitutional question.
Yeah.
It's not going to resolve the political debate. No matter what the court decides, the Republicans are going to continue to try to repeal and replace Obamacare. You know, if the court turns down, if they turn down the entire law, the Democrats are going to continue to make efforts to salvage as much as they can legislatively. Yeah. So the fight's going to go on. It's going to be a political battle that'll continue possibly for several years. Yeah. And what happens in the elections clearly is going to matter quite a bit in terms of the direction that things head.
That's wonderful. All right, thank you, my friend, and thank you for your work. This is terrific, and we'll get you back as things unfold, because I'd like to get your opinion as this thing comes back to the forefront.
Happy to do it. Thank you for the interview.